Come in.
Is this Michelle Chow?
Yes, hi.
Hi, my name's Laura. I'm going to be the nurse practitioner and student seeing you today.
Nice to meet you.
Can I call you Michelle?
Yes.
Okay. And I understand you're here for a physical wellness exam. Is there any other complaints or concerns you'd like to discuss?
No, just a wellness exam.
Okay. Before we begin, I just need to go over your history real quick. So do you have any past medical history?
Nothing major, just a recent tibial fracture.
Okay. And how'd you do that?
It was a skiing injury.
Okay. Have you ever had surgery before?
No.
Okay. Do you take any medications on a daily basis?
No, just like Motrin if I need it, and then Benadryl if I need it.
Do you take any other herbal supplements?
No.
Okay. Are you allergic to any medications?
No.
Do you have any other allergies?
Just seasonal.
Okay. Let's go over your social history. So what do you do for work?
I'm a nurse.
I'm a nurse. Do you work full-time, part-time?
Part-time.
Okay. And what's your highest level of education?
I'm working on my master's.
Full-time or part-time?
Full-time.
Okay. And who do you live with?
I live with my sister.
In a house, an apartment?
In a house.
Okay. Any environmental exposures, either at work or at home?
Maybe just at work, needles, medications, bodily fluids, stuff like that.
Okay. And what about alcohol intake? How much do you drink?
Probably like once or twice a week.
Okay. And how much do you drink when you drink?
Like one or two.
Okay. Liquor, beer, wine?
Mostly beer.
Beer, okay. Any tobacco use?
No.
And any other drug use?
No.
Okay. And how about diet and exercise? Do you exercise on a daily basis?
Well, I did before my injury, probably like 3 or 4 times a week.
Okay. Cardio, weightlifting?
Mostly cardio.
Cardio, okay. And how's your diet?
I'd say it's fairly good. I probably eat too much junk food, but
Okay.
cutting back.
Good. And what about caffeine intake?
Oh, probably way too much. Once a day.
Once a
Like
day?
just a cup of coffee in the morning.
1 serving a day? Okay. Okay, and are you sexually active?
Yes.
How many partners?
Just one.
One, male or female?
Male.
Okay. And do you use protection?
Yes.
Barrier protection?
Yeah.
Okay. And are your immunizations up to date?
Yes.
Okay. Did you get your flu shot?
I sure did.
All right. Now, preventative health. Have you gotten any screening exams done? Like when was your last pap smear?
It was probably almost 2 years ago.
2 years? Okay.
Everything was fine.
Everything was
Yeah.
normal? Okay. Did you get a breast exam as well at that
Yes,
time?
I did.
Okay. Let's see, what else? When was your last physical?
Probably a year ago.
Okay. And no colonoscopies or mammograms or anything
no.
like that? Okay. All right, and let's go over your family history. Do you have any siblings? Oh, you said you live with your sister.
Yeah, just the one sister.
Okay. Does she have any health
No,
problems?
none at all.
And what about your parents?
Both parents are alive. My dad doesn't have any issues.
Okay.
And then my mom, she's got neurofibromatosis type 2.
And what about grandparents?
On both sides, they're deceased.
Oh, I'm sorry. Did they have any significant medical history?
Not to my knowledge, no.
Okay. Unsure? Okay. Is there anything else you'd like to add about your history?
No.
Okay. All right, let's begin the physical part of the exam. Just wash my hands, and I'm going to wear gloves too.
Okay.
So because this is a wellness exam, we're going to do a full head to toe, okay? If at any point during the exam you want me to stop, say stop, and I will. Okay. First, we're going to start with your hair. Check for normal hair distribution, any lice. Skin looks good, no rashes or lesions noted. Nails look good, good cap refill. Okay. Next, I'm going to look at your eyes. Eyebrows look good. Conjunctiva. No redness or drainage. Okay. Okay, I'm going to have you look straight ahead. Follow my finger in with your eyes. And back out. Okay, now we're going to test your visual fields.
Okay.
Okay, cover your right eye. And then, how many fingers am I holding up?
3, 2, sorry, 1, 1, 2,
Okay, now cover your left eye. And same thing, how many fingers am I holding up?
2, 1, 1, 2.
Okay, good. Now I'm going to look in your eye with an ophthalmoscope, looking at the vessels of the eye and your fundus. Okay. Look up for me. Good. Good. Eyes look good. When was your last vision test?
6 months ago?
Okay. All right, now I'm just going to look at your ears. For any redness, tender right here?
No.
No. Okay. Piercings look good, no infection. Look at the skin. Any tenderness right here?
No.
Okay. Tympanic membrane looks good. Good. Everything looks good.
Okay.
Okay. And check your nose, checking the skin. Any tenderness here or here? No. Okay, good. I'm just going to look in your nose real quick. And your turbines are nice and pink. Your mouth, can you pull your lip down for me? I just want to check your gums. Good. And the top part? Good. Dentation is good. Can you stick out your tongue for me? All right. Let's look in there. Can you say ah? Stick your tongue out. All right. Good. Tonsils are 1+. Good. Good, good, good. Palpate the anterior chain, the posterior chain. Okay. Just going to check your thyroid. Any masses or... Can you swallow for me? Okay, good. All right. Visually inspect the chest wall. No rashes, lesions. Symmetrical rise and fall. Just going to listen to your lung sounds right now, okay?
Okay.
Take a deep breath for me. Good. Again. Good. Good. Okay. Same thing in the back. Take a deep breath. Good. Again. Again. Okay. One more time. Okay. Okay. Just gonna check your pulses. Good. Can I have you hold your breath? Okay, you can take a deep breath if you need to. Hold your breath again. Good. Okay, check your pulses. Okay. Oh, do you mind removing your shoes for me? Sorry. I'm just going to listen to your heart, okay, so you can breathe normally during this part of the exam. Good. Heart sounds are normal. Just going to feel your pulse. Do you mind holding up your bra for me? Thank you. Got a strong one. Thank you. Okay, now I'm going to check the abdomen. Do you mind lying flat on your back for me?
Sure.
Okay. I'm just going to lift this. Visually inspect the abdomen. Just going to palpate your abdomen. If you have pain at any time, let me know.
Okay.
Okay, you can sit up. Okay. Now we're going to check your neuro system, okay? So I'm just going to do a couple of tests that are going to help me check your cranial nerves.
Sure. Okay.
So you already had the visual acuity done prior to my assessment by the medical assistant. Your vision's 20/20, so that's perfect. And you do not wear corrective lenses. Okay, good. All right, look straight ahead for me and follow my finger. And keep following my finger. Good. Okay. Face. All right, clench your teeth for me. Good. Okay, now raise your eyebrows, puff your cheeks out, and smile for me. Big smile. Okay. All right, I'm going to whisper something in your ear, and I want you to repeat it back to me, okay?
Okay. Apple. Orange.
Okay. Now I want you to stick out your tongue. Open your mouth, stick out your tongue, say ah, ah, and swallow for me. Good. Turn your neck side to side. And raise your shoulders against my resistance. Good. Okay, and then I want you to stick out your tongue again. And then press it with your tongue, press against my fingers in your cheek. Good. Good tongue strength. Okay. Now we're going to do a couple tests to check your balance and coordination. So if you don't mind stepping down for me. I want you to walk in a straight line with your heel to your toes. Good. And turn around and come back. Good. Okay, and stand right here for me. I want you to close your eyes, keep your hands at your side, and don't let me push you over. Okay, all right, you can have a seat on the bench for me. Okay, I'm going to test your coordination now, so I want you to touch my finger and then touch your nose. All right, I want you to take your hands, and as fast as you can, go like this. Okay, good. And then using your heel, I want you to slide your heel on the opposite leg from your knee to your ankle. And back up. Okay, and same thing on the other side. Okay, good. All right, close your eyes. I want you to tell me right or left which side I'm touching.
Left.
Or both.
Both. Right. Left. Left. Right. Both. Both.
Okay. And next I'm going to check your reflexes.
Okay.
So just keep your arms relaxed for me. Okay. Good. keep your leg relaxed. Can I do this one with no pain? Okay. And your Achilles. Okay. Everything is within normal limits. All right, now I'm gonna check your muscles. And no pain or tenderness? Okay, and I'm gonna check your strength, so I want you to put your arms like this, push against me, pull away, put your arms up, push against me, push down against me. Okay, push your knees together and out. And same thing down here. Okay, and push on me like a gas pedal and pull towards you. Okay, good. So this completes my physical assessment. Everything is within normal limits, so we'll get you ready to go. Do you have any questions or concerns?
No.
Okay.